Okay. It's Tuesday's tip with Dr. Britt.
This week's Tuesday's tip is kind of debunking 5 myths about back pain. And we hear this a lot in the office. We have people actually ask us these questions all the time. And myth number 1 is cracking your back is bad for you. Cracking my neck, is it bad for you? It's not bad for you. The thing is, it's not actually getting the segment that's stuck. But it feels good. Doesn't hurt anything, so don't sweat it too much. The other myth number 2 is one wrong move will cause permanent damage and ruin my back. And that's usually not true. Movement over time is or poor movement over time is what causes a lot of the back issues we see, or a lack of movement. And it's not just one thing that sets you off. You know, most people say, oh, I reached down to pick up a pencil and my back was gone and I couldn't stand up again. That was just the straw that broke the camel's back, and it was the lack of movement and poor movement prior to that started that. Myth number 3 is bed rest is the best thing to heal your back, and that one's totally wrong. Most back pain, back issues are movement related. The best way to take care of that is to start moving again. And once you start laying down in bed, you start losing strength pretty quickly. Everything relaxes, and then you get scared to move. And so bed rest is not the best way to heal your back. Myth number 4 is x-rays and MRIs are needed every time. And that's another myth, because they're not. In fact, recent research states that 90% of back pain cases can be dealt with in just a good physical exam and actually taking a good history, which is just listening to the patients. So you don't always have to have an MRI. And then myth number 5, there's nothing to do to prevent back pain. And that one's pretty much bogus, because proper warm-ups, making sure that your core is engaged, doing exercises as part of your exercise routine or just everyday life to get the core to fire off will stabilize your back and prevent most pain. So we'll put a little bit more in the literature part of this, but those are 5 myths. They're not true. If you have any questions, don't hesitate to give us a call. We're here to help you move better, feel better, live better, pain-free.